Today is 8th of December 2024 and Sunday, okay? See, many people have asked me about hemorrhoids. Hemorrhoids are also called as piles. I'm a surgeon myself who did a lot of hemorrhoidectomies, okay? So, first is, how did the name come? How did the name come? What is hemorrhoids? Haema means blood. Ros means flowing. Blood flowing. This is in Greek language. In Greek language, haima means blood. Ros means R-H-O-O-S. Ros means flowing, blood flowing. So they have seen blood flowing and they called it as hemorrhoids. Okay. Then the Latins gave the name piles. Pylon, pila means ball. Ball. Okay? In Latin, pila, P-I-L-A means ball. So two names, hemorrhoids and piles. Okay? So the two names itself you will know the symptoms, what problems they cause. What problems they cause is in the name itself. One is blood, second is ball. Ball coming out from the anal canal. Okay, easy to diagnose. Now, etiology. Etiology means what causes piles. Etiology means cause. Cause, okay. The first is hereditary. In some families, there are 4 points in etiology, okay. First point is hereditary. It can run in families. If father has, grandfather has, you can have hemorrhoids. Second is morphological, okay, morphology, okay, evolution, okay. The animals, they have 4 legs. So most usually animals don't have piles because they're not standing, okay. Whereas human beings, they stand. All the weight of the column of blood is on the veins. Is on the veins. Veins don't have walls. So all the blood is in the, especially when straining, is in the anal canal, rectum. You understood? So because of the weight of the column of blood, no walls, the veins try to, come out through the weak points. That's how piles result. So second is morphological. Third is anatomical. Third is anatomical. Here, the small veins, the small vessels, they get constricted by the anal sphincter, by the fibers of the anal sphincter during defecation. And this is the anatomical reason. Fourth is exacerbating factors. Exacerbating factors, important is constipation. More constipation, more hemorrhoids. Okay? So 4 etiological factors. 1 etiological factor is hereditary. Second is morphological. 3 is anatomical. 4 is exacerbating factors. Over. Next is clinical features. How does a patient come to you? Is called as clinical feature. Clinical features means how patients present. They are also called as symptoms. First, I told you is bleeding. Patient tells you there is bleeding through the anus. It happens in first degree piles. Before that, I have to tell you what are the degrees of piles. There are 3 degrees. First degree means it is inside the anal orifice. The piles are inside the anal orifice. Second degree means they come out, they go inside. They come out, they go inside. During defecation, they come out. And after defecation, they may go inside. Or sometimes the patient will push the hemorrhoids inside and they go inside. The third degree means they are always outside. They don't go inside. The 3 degrees are, first degree is they are inside the anal orifice. Second degree is they come out and goes inside. They come out during defecation and they go after defecation, either spontaneously or manually by the patient. Third degree means they are always outside the anal orifice, okay? So bleeding is common in the first degree piles. First symptom. Second symptom is prolapse. Prolapse is common in the second degree and third degree piles. Prolapse means patient will tell, sir, some ball is coming outside. Balls are coming outside. The hemorrhoids are coming outside. And they are going inside, or I am pushing them inside. And after some months or years, he tells, so they're coming out, I want to push it inside, they're not going at all. The third degrees, okay? This is prolapse, symptom prolapse. These 2 symptoms are very common presentations. One is bleeding, second is prolapse. The third, other rare symptoms include, very rarely, patient may present with third, discharge. Fourth, pain. Pain is very rare, but sometimes they may present with pain, especially hemorrhoids due to some other causes, some other systemic causes. Fifth symptom is anemia. Okay, a patient may come with anemia, very rarely. Okay, the patient will be too shy to tell that he has got something below the anus, especially a woman. So they come to the doctor when there is no blood at all, when they're too anemic. So what are the 5 symptoms? First is bleeding. Second is prolapse. Okay. Third is discharge. Fourth is pain. Fifth is anemia. Okay. Now the patient came to you. Now investigations. You have to diagnose it. 4 points. What are the 4 points? First is inspection. You see the anal canal, you see the outside of the anus, okay? There are skin tags. That is, external hemorrhoids can be seen. Third degree can be seen in the form of skin tags. Okay? Inspection. Whereas first degree and second degree cannot be seen, and you may have to do digital examination. Generally, you do digital examination. You keep your 2 fingers into the rectum, anal canal and rectum to palpate, but very rarely you can palpate the piles. They can be palpated only if they're fibrosed, generally not palpated too. 3 is you keep a proctoscope. There is a proctoscope instrument, you keep it inside. Okay? You can definitely see the piles, especially first degree and second degree you can see. The next investigation you have to do is, if there are piles, also keep a sigmoidoscope if possible, so that to see what is the cause of the piles. So what are the investigations? First is, what is the examination? Come investigations. First is inspection. You can see the third degree piles or skin tags. Second is distal examination, perrectal examination, PR, that is what we call is perrectal examination. Third is proctoscopic examination. You keep the proctoscope in the anal canal and the rectum. And fourth is sigmoidoscopy. You see what is inside. Okay? Now you have diagnosed, you confirmed there are piles. Now what you should do? You have to treat the patient, okay? First is you can try conservative treatment, okay? Or symptomatic treatment. See, what is the main cause of piles is constipation. Okay, you try to relieve the constipation and there'll be a lot of relief for patients and first degree piles can disappear. If you give good laxative, if you use food consists of most of fibers, if there is no constipation, there won't be piles, okay? So first treatment is conservative, okay? Second is injection treatment, injecting sclerogens. You can inject sclerogens in first degree piles. What you do is you take a long syringe and a long needle, you inject the sclerosing agent at the area of the pile, okay? Once this injection is given to the pile gets fibrosed. The pile gets fibrosed. The treatment is successful if the patient is having first degree piles. Okay? The third method is banding. You can keep a rubber band, okay? On the pile. If you keep a rubber band, what happens? There will not be blood supply to the piles and the piles can fall off after some time. This is called as banding. Next is cryosurgery. Cryosurgery means you take a cryosurgery probe, you keep a liquid oxygen. This liquid oxygen is at a degree of minus 160 degrees centigrade. So you keep this probe at the pile, it freezes, freezing. Because of the extreme low temperature, it freezes. Freezing causes fibrosis. After that, it may fall off. But nowadays, not much importance is given to banding, not much importance is given to this cryosurgery. After banding and this also cryosurgery, nowadays they are not much following. Okay. So last is surgery. Surgery means removal. Hemorrhoidectomy, removal, okay? Hemorrhoidectomy. Removal of the hemorrhoid is called as hemorrhoidectomy. Okay? Removal of the gallbladder is called as cholecystectomy, removal, okay? Appendicectomy, removal, okay? Now you're removing the piles, removing the hemorrhoids, and it's a definitive treatment and highly successful treatment. This hemorrhoidectomy is treatment of choice for third degree piles. A definitive treatment for third degree piles is hemorrhoidectomy. So tell me all the treatment modalities. One is conservative management. Two is injecting sclerosing agents. Three is banding. Fourth is cryosurgery. Fifth is surgery proper, that is hemorrhoidectomy. Okay? Have a good day. Have a wonderful day. Bye-bye.